really started with my daughter about 18 years ago. She had had 2 or 3 years of fairly bad health with stomach upsets and headaches, and she was just starting university, and after 2 or 3 weeks came home feeling very ill. She was almost immediately admitted to hospital, initially for very low sodium levels, but then she had very severe medical problems, stayed in hospital and nursing at home with liver and kidney failure. Over about 3 months, she lost something like 15 kilograms in weight, began to recover, and then a couple of months after she was sort of starting to recover, on a follow-up visit, she happened to ask the doctors about some strange marks on the back of her hand. We were very fortunate that the specialist dermatologist she was talking to recognised and knew about Variegate Porphyria, called in some colleagues, and they decided she had Variegate Porphyria, and that was the cause of the problems over the last 6 months. So at least we knew why they occurred, and we knew what to do to limit the chances of them reoccurring, although they have reoccurred since. After that, the other family members were tested for porphyria. At that time, it was biochemical testing, gene testing, DNA testing wasn't really up and running by then, and I was shown to be positive. I've never had any sort of severe acute attacks that meant I needed to go into hospital. I think I've had some minor symptoms. Often, sometimes going away for a business trip, afterwards I would feel, several days later, I would feel very tired and depressed. When I stopped drinking alcohol on my business trips, it seemed to cure that. It's pretty much a normal life. I mean, the most obvious thing I have to avoid is alcohol. Other than that, it's really a matter of making sure that all the doctors that treat me know I have porphyria and know that they make sure that the drugs that they are prescribing for me are safe for people with porphyria. I think I was lucky to have a dermatologist who had heard and recognised porphyria. It's very little recognised by even most specialist doctors. We've a handful of doctors in England, in the UK, who are very knowledgeable on porphyria. The majority of the medical profession know little or nothing about porphyria. And I think if anything it's worse, the older doctors tended to be taught about porphyria in their medical school training many decades ago, even though they'd probably never met a porphyria person since. The newer ones probably haven't even had it in their training. It's important that porphyria awareness is raised to doctors, to medical professions, probably most important, accident and emergency departments, because a lot of them aren't really aware of porphyria and don't recognise it. The other thing, I think, is the importance of testing. It's important, this is for family members, if other members of your family have porphyria, it's important to know if you have got it, so you know what to avoid to cause attacks. We're beginning to get a lot more work between different organisations. It's always useful as an organisation to meet other organisations doing the same thing. Because it's so rare, inevitably, we're the only ones in the UK. So we're talking about meeting people abroad, and so bringing the various organisations in the various countries together. It's starting to happen, and the previous 2 porphyria patient days, international ones, have been useful starters, and it's really growing momentum, and I hope the cooperation will continue.